Welcome to Combos from the Couch by LifeStance Health, where leading mental health professionals help guide you on your journey to a healthier, more fulfilling life. Hello, and welcome to another episode of Combos from the Couch. I'm Nicolette Lianza, and joining me today are LifeStance Executive Clinical Director Matt Solid and psychiatrist Dr. Joseph Fondries. And we'll be exploring GLP-1 medications, going beyond weight loss to understand what's really happening in the brain and body when someone takes these medications. So thanks for joining me, Matt and Joe.
Thanks for having me.
Thank you for having me too.
Yep. So let's dive in. Let's actually start with, if you can both share with us a little bit about yourselves. Matt, why don't we have you start us off with that?
Sure. My name is Matt Solid. I am a social worker by degree and still doing a little practice out of the state of Michigan. I am the North Division's Executive Clinical Director. So for the North, I do have the therapy service line here to support all of our therapists. I do also have a background in food culture, how that impacts our mental wellness, how that can change our mental states. So definitely a very interesting subject as far as how it impacts that. That's just a little bit about me.
Okay. Thank you, Matt. And Joe?
Hello. Yes, I'm Joe. I'm a psychiatrist, or Dr. Fondries. I'm a psychiatrist. I do a little bit of everything. I do standard medication management. I should say outpatient. So standard medication management, I do psychotherapy sessions, I do marital therapy, I also do procedural psychiatry. I run a Spravato clinic, we also run the TMS clinic. So I'm fortunate enough to have a lot of experience with just about everything psychiatry has to offer as far as outpatient therapies go.
Nice, great, wonderful, thank you. So as we begin, let me start with this first question of what's happening in the brain and body when someone takes a GLP-1 medication. So Joe, do you mind starting us off with that question?
Yeah, absolutely. Okay, so these GLP-1 medications, there's a whole lot of them. They all work approximately in the same way. There are, we'll say, subtle differences, but generally speaking, I find the main difference between them to be the different indications for which they are FDA approved. So it does come down to oftentimes like different ways to get it approved and purchased or acquired, but all of them kind of together, something they have in common, more or less. So these are analogs of glucagon-like peptide. That's one. So this is an incretin hormone. This increases glucose-dependent insulin secretion, decreases inappropriate glucagon secretion, increases B cell growth and replication, slows gastric emptying, decreases food intake. This is a combination of changes in the body that more or less alters metabolism to make it easier for a person to keep the weight gain goals that they want. It does also appear to be psychoactive. That is more of observational basis that I, as well as other practitioners, have seen. Yeah.
Yeah, no, thank you, Joe. Matt, anything you'd like to add to that?
No, I will yield to the medical side for that part of things and
Yeah.
make sure that I stay in my scope.
Yeah, no, I appreciate that, which then brings us to, what psychological impacts could clinicians be paying attention to, should they be paying attention to? So Matt, let's have you take that one.
Yeah, I mean, absolutely. And the psychological impacts are so interesting. Food has such an important part in how we connect with each other, how we communicate with each other, how we, in a lot of ways, connect with ourselves. So anytime you're going to do something that's going to cause a major shift in eating habits, there are some positives and some negatives that can happen. And in some cases, we see lots of people, or in both anecdotally and in the research, who feel better about themselves. They're happier. They're going out to eat more. They feel better. They are talking more, and they feel comfortable with that. And even talking to some people that I know that have tried these medications, well, yeah, it's great. I go out to eat. I just order less, and I still feel much more comfortable going out to eat. So you can see a lot of that positive and a lot of that increase in self-esteem and self-confidence that for many people comes with a healthy weight loss. On the other side of things, and there are so many variables here, but on the other side of things, for some people, you imagine a story where you go home to a family event, And everybody has food. That is always what connects us at many family events. And imagine somebody going, "Why aren't you eating? You should eat more. How come you didn't try dessert? Why didn't you try this dish?" And then for some people, that can feel a little bit like they're being put on the spot. It can create some
Mm,
anxiety. It can create some
right.
feelings of isolation. So you want to keep an eye out for those feelings of isolation. Provide empowerment for those that are feeling really good with it, and provide maybe as from a psychological standpoint some skills for, like I said, those that feel like they are maybe embarrassed or maybe have to explain to others. So definitely a strengths-based approach there can go a very long way in really addressing some of those or encouraging the positives.
I agree. Joe, anything you'd like to add to that?
Yeah, I think overall agreed with everything Matt had to say. I think the main thing that I see working for these patients who I see starting these meds, and overall, I do feel like these meds it's a big deal. These GLP-1s, there's always been this joke in America that the first person to invent a really good weight loss med is gonna be doing well, and they are. This is kind of
Mhm.
delivering to people the control that they want over their metabolic, goals and weight loss that so many people have been struggling with their whole life. Main thing I see is basically that control leading to higher self-esteem. That's a big deal. So many people have been
Yeah.
trying so hard and not getting the results they're looking for due to metabolism or any other factors. It makes a person feel like they are basically a failure. And then suddenly, through the same amount of effort, they're actually having success. That's delightful to see.
Yeah, thank you. So could these medications, do you think, be triggering for individuals with eating disorders or body image concerns? Matt, your thoughts on that?
It's really interesting. We're still looking at a lot of peer-reviewed research and studies
Yeah,
about kind of how that impacts us. We do know on the very positive side of things that they have a good impact with those with binge eating disorders or symptoms coming from binge eating disorder or from bulimia. As far as how they could be maybe negatively triggering, I haven't seen a lot there. What we might see is that if people go off of the medications, some emotional impact from possible rebound weight gain, things like that.
right,
So it's that the impact can really also come from feeling like they need to stay on the medication or feeling as though
right,
this is a forever thing. And that I could see really acting as a trigger or creating sort of a snowball effect for some folks. So we want to be
right.
pretty careful there.
Yeah, definitely. Thank you. Joe?
Yeah, I've got to agree with Matt here, which is to say that overall, if I were to overall give my perspective so far, I think I've seen them just be profoundly positive on average. These are finally giving people the control they've been looking for forever. One of the psychological effects I see stated over and over and over again by people who have started on these meds is it decreases what I call food noise, which is that background kind of thing in the back of the mind, which is like just thinking about the extra donut, just thinking about the Dr. Pepper. And that seems to be subtracted out. And it takes a lot less kind of discipline and forcing it for a person to eat, let's say, in line with their goals that their diet would have or what their body actually needs, as opposed to doing what I just call like dopamine seeking behavior or eating just for that hit. I don't know, a little bit like a drug, a little bit. That second category gets a lot better. As far as the triggering part, very interesting question, right? So, something that I've seen is that it seems to me like a lot of the people who are struggling with weight loss image, certainly getting on these meds does not seem to be triggering because they are able to kind of get to their goals. But I think a
Mhm.
little bit, people who are comparing themselves, let's say, this was, I think, worse a year or so ago or 2 years ago when the meds were, I actually don't remember exactly when they came out, but around when they first came out, they were not as equally available. So some people would be unable to get it through their primary care, but they would see, let's say, Hollywood celebs able to get on it, pay out of pocket, whatever it takes.
Right.
That feels bad, and I do think that can be triggering if you're seeing other people have success with something that's unavailable to you. I will say I have had one case of one patient who had been eating over the course of their life as like an anxiety response to like calm things down. And that was something interesting. They actually noticed their anxiety get worse as they had better control over food. And we had to actually more or less discover new anxiety coping techniques. But by and large, people tend to handle that one and feel so much better about making success with their goals. I don't think that being on the med, I've seen trigger people very much. I will agree with Matt about the things he said about it being a theoretical concern and something to pay attention to. Of course, we shouldn't dismiss it. But overall, I can't say that I've felt that it worsened too many people's psyches.
Okay. All right. Which leads us to looking at some of those emerging mental health benefits or risks. Are there some worth discussing as this use expands when it comes to the benefits and risks? Matt?
Oh, sure. Benefits. I mean, and more from those mental health benefits, and to be the physical health benefits. People we've seen, and in both anecdotally and in research, are making better food choices. They're becoming more involved and more in tune with what they're eating. They're becoming more in tune with where that food comes from, with how it's prepared, with how it's made, and they're showing positive effects for families as well, making
Hmm.
better food choices, moving more toward a slow food movement because you're not as dependent on sort of making all of this food, but people making these good food choices, which really does last. That really does kind of continue and expand to other people, other family members. So we saw that avoiding junk food, avoiding fast foods,
Hmm.
and really, easing away from that culture of food convenience because it's really, makes us much more conscious of it. So
Yeah.
that's going to bring about not only a positive physical impact, but a positive mental impact and social impact, familial impact that we see coming from these medications. And it's really been fascinating and quite beautiful to sort of see how that's shifted. But and it's so neat also to see that researchers agreeing with it and that we're seeing this sort of much more universally. So I'm excited to see some more of those impacts as well and how that sort of changes our food culture in this country.
Definitely.
I,
Joe. Yeah.
this is a really complex topic for me. So I'll try to run through like the basics, but we essentially live in America in a society that is purchased or perched on decades of what I'm going to call food science, which is to say that a lot of our foods that are easily accessible or cheap are basically not so much real food, so much as like a lot of like engineered and processed food like things that have been engineered through basically food engineering to be more tasty, more fat, more sugar, more HF, high fructose corn syrup, salt, all of that. And so to some degree, I do view common food as like a little bit like a drug, right? And so what's challenging then is that these are engineered to be addictive and have been so for decades, longer than many young people have been alive. So what happens is it's very easy for a person to lose control over their eating habits, gain more weight than they realize, and then the culture that we're in more or less just provides shame. So you just feel really terrible about losing control. And it says, you don't have like control or discipline or whatever. And then that probably or unfortunately leads to a negative feedback loop where a lot of people who struggle with this eat more to contend with negative feelings. Like that same sort of person a lot of times emotionally eats, which of course kind of creates a bad cycle there, right? That's really tough. And then I think a really interesting intersection there is what has been the fat acceptance or body positivity movement. And the initial idea or goal of that movement was to try to relieve some of that guilt and shame so that the person could kind of love their body and make progress towards the goals that they want. This drug is now interesting because it allows people to actually make progress on the goals they want as opposed to sort of like I think if a person's been struggling with this and they're big enough, it's discipline alone is just never going to do it. So it's really good to actually have reasonable options. This is, in my opinion, safer and less invasive than like gastric surgery. And I would say, my opinion is it should be first line over surgery. So I think, are there emerging physical health risks? Who knows? We don't know anyone who's been on it for decades. I think the complex thing here is to simultaneously acknowledge that body acceptance is still important, but it's more about relieving a person's kind of self-hatred as opposed to saying that they should stay at a very large weight. I mean, the science is indisputable that if someone's like morbidly obese, that's going to cause so many health problems. So it's not necessarily about staying at a dangerous weight so much as accepting a person as a good person. It's not like a sin. It's just something that has happened from decades of this food engineering. It's something along those lines. And this is like complex in terms of, I guess, like
Yeah.
ethics and science.
Yeah. Very true. All great points there, Joe. We alluded to this a little earlier in the episode, but when someone stops taking a GLP-1 medication, what really happens mentally and physically? So
So that one I happen to know. So on
yeah,
average, unfortunately, they do gain a bunch of the weight back, right? So the stats is that if you can keep someone at a particular weight and they are stay there for the recommendations 1 to 2 years, as far as I'm aware, even if once they hit target weight, they generally speaking should stay on the med for that 1 to 2 years because that builds not only the metabolic shifts we're looking for, but even as important or more important habits. And so that is what can lead to someone having sustained success at a particular weight, even as you eventually taper down or maybe even discontinue the med. I unfortunately am aware that if you stop it abruptly and it has not been that much time, a lot of the weight can and oftentimes does come back. This is terrible because in the modern world we have these meds are all paid for usually through insurance. They're very expensive out of pocket, and we have a modern world where sometimes insurance coverage can be related to employment or unstable, or the new year rolls
yeah,
around and you have newer insurance prior authorization requirements. So I have seen people coming off and on these meds even through the best of intentions, but that to answer the question directly, if the med is
mm,
stopped, oftentimes unfortunately the weight does come back. And then so what happens psychologically, all bad. Yeah,
yeah.
that feels bad, fair to say.
Good way to put that, all bad. Matt,
Yeah.
anything you wanna add to that? To all the
The
bad?
hope is really, and this is where therapists and physicians, nutritionists, where we're in, and just to really sort of double down on what Dr. Fundry said, it's so important to build those habits. It's not just losing the weight; it's building good eating habits. And even if
Mhm.
you go off of the medication and you have good eating habits and you have good exercising habits, the hope is that you'll continue to feel really good about yourself. And but it can't just be the medication. It needs to be more than that. That has to happen
Mm,
in order for somebody to really go off of that medication and sustain it.
right, definitely.
Yeah,
Now
good words,
looking
well
ahead
put.
yeah, no, I agree. So looking ahead, we'll say 5 to 10 years, how do you think the widespread use of GLP-1s might change our relationship with food, body image, or even mental health treatment?
I think that's a great question. So first off, just obviously saying this is obviously me just speculating because I don't know for sure. That's a long time in the future. But the first major change that I would be aware of, or guess, let's say, is that that might be enough time for some of these patents to expire, which might make some of these available in a generic form, which would mean larger and
Mm,
more wide scale access, even outside of
mhm,
insurance prior authorization. The insurance situation really is a major barrier to these treatments, and that impacts every single part of them, even including their efficacy, in my opinion. Like we talked about with having to quit, that comes up often in clinical practice. So that's a big one. Is more sustained access to the med. Two, I think it may actually change the way if it's easier to just get quickly. So many of the indications currently more or less assume that the person has to have passed a certain level of dysfunction. What do I mean by that? A certain weight metric, HbA1c, diabetes, cholesterol, whatever. A person has to already be struggling in order to take this med. I think that one thing that could be interesting to see in the future, if these were just widely accessible at a prescriber's indication or desire, is basically someone using these meds in a more short acting, let's say, burst, using it for a few weeks, maybe a month, not for years and years, just to try to like take a few weight pounds off. That is something that would be possible theoretically with the mechanism, but right now it's just not how it's done.
right,
I think it would just be like easier to do a little bit of it instead of having it all or nothing.
that too. Matt?
I'm going to say this like a foodie. I mean, I'm definitely a foodie, and there's only so much that I can eat. I want to make it count, and I want to make that food good food, and I want to make that food something I really enjoy eating, and something that is good for me, and something again going back to that idea that's fresh, that feels right, that goes along with the other lifestyle changes that I'm making, while being on a GLP-1. So it may make hopefully an impact on food choices, which can
Mhm,
make a big impact on the food system, which makes a big impact on what is sold in grocery stores, makes a big impact on how food is advertised to it, raised, grown. So I see our relationship with food, hopefully with these changing, certainly for the better, and with body and people feeling better about themselves. People feeling better about themselves because they're hopefully eating better foods.
right.
That they are feeling like they maybe look the way that they want. So I see a lot of positive there. I know that there is some fear that now all of a sudden all that's going to be attractive is thin. You had mentioned that earlier, but I think that it'll hopefully create a shift. And depending on how those of us in the health community, the media, how it's portrayed as being healthy is healthy. Not so much thin or healthy is healthy and what that really means, what truly
Right.
being healthy is.
My gosh, Matt, Joe, thank you. Thank you for sharing all your insights and knowledge on this topic. And I believe our listeners are going to be walking away definitely much more educated, especially if some listeners weren't sure if they should be maybe looking into this a little bit more and taking it. So I think you did a really great job answering some of these questions for them too. So thank you again.
My
Thank
pleasure.
you.
Thanks for having me.
Yep. I'd also like to thank the team behind the podcast, Jason Clayton and Juliana Whitten. Thank you for listening to Converse from the Couch. Take care, everyone.